Margolis. I'm an orthopedic surgeon, and I'm going to give you a tour of my lab. In my lab, we are focused on bone tissue engineering and implantable biomaterials, and I'm going to show you a little bit of what we do. We have a wide variety of techniques that include 3D printing, cell culture, and analyzing tissues after we've implanted the devices and scaffolds that we make. Over here we have Patrick. He's currently working on one of our few 3D printers that we have. The goal of the project that he is working on is to 3D print biomimetic scaffolds that we implant into bones in order to accelerate bone growth, which we are trying to develop to treat patients that have very large bone defects. Next, I'm going to show you a far-out view of our tissue culture lab. So this is our tissue culture laboratory. Inside of here is where we do all of our human cell culture. We usually get stem cells from fat, and we can turn them into bone and cartilage cells, and then we can place them on the scaffolds that we 3D print before we implant them. And we found that using stem cells can accelerate bone and cartilage growth in order to heal these very large defects rapidly. In order to better understand how the cell culture works, because our tissues are usually loaded and the load that we have actually helps the tissues grow, we have a couple of students that are over here working on making a bioreactor, and the point of the bioreactor is to load cells as we're growing them in order to grow better quality tissue prior to implanting anything in a patient. The other thing that we do is after we've implanted the scaffolds and cells inside of an animal model, we want to assess how well it worked in order to regrow the bone and cartilage tissues. In order to do that, we do histology. So when we do the histology for these tissues, we have to embed the bones into a very hard substance in order to be able to take thin slices that we can look at under the microscope. This shows a rat bone that has a scaffold implanted and is embedded in a hard plastic. Once we do this, we can take a very thin section using a saw that we have, and then we can grind and polish those sections, which you can see Anthony working on right here, in order to get a very nice thin section that we can then stain and look at under a microscope. On a side note, this is Robert, who's a medical student doing research in our lab, talking to Dave, our lab manager, who makes everything in here happen. Over here we have a chemical hood that we can use in order to stain our slides. So after we cut them very thin, grind them down and polish them so that we can see them under a microscope, we stain them so that the bone and other soft tissues show up different colors on the slide and we know what we're looking at. We also work on some implantable electronics and have a separate area over here in the lab where we work on making sensors that we attach to our scaffolds or get them to attach directly to bone. And then finally we have a tiny room here where we have a lot of different microscopes as well as a small high-resolution CT scanner. And we use this equipment to actually measure what's going on from the slides that we've produced. And with the CT scanner, prior to cutting up a specimen to make slides, we can image any new bone growth that has occurred within the scaffolds we've implanted. I really appreciate your time, your attention, and all the help from everyone at the SIMI program for making this wonderful research happen.